Hello friends, my name is Dr. R.K. Shweta. As I have told previous also, I have done DCH followed by which I did my MD Pediatrics. This video is a continuation of the previous video in which I discussed about the books which should be read during pediatric residency. Recapitulating the past video, I have mainly discussed about 5 books which are the most essential books in the initial 3 to 6 months of the residency. The books were Drug Dose by Meherban Singh, OP Ghai Textbook of Pediatrics, then AIMS NICU and PICU Protocol, a book by Arjume Lakshman Swami, and then the last one was Santosh Kumar. In this video, I will discuss in detail about the other books which are necessary during pediatric residency and which are needed. So let's begin. The first and the most important book which you will read in the whole pediatrics is Nelson Textbook of Pediatrics. I have the book also. This is the book. This is the international edition. Presently we get this book only. It is in 2 volumes, but it is very heavy. So I have divided it into separate parts, at least 6 to 7 parts. The first volume of this book is not that much necessary because it has the basic parts only, but the second volume of the textbook has all the important systemic parts. I will suggest you to buy this book at least spending 3 to 6 months in the residency. The reason is this book is for reading this book you will require some basic information and knowledge about the subject. I how to read this book I will make a separate video about it. There is separate book which is known as PG Textbook of Pediatrics by Dr. Piyush Gupta sir. That book comes into 3 volumes. I have read Nelson and that book also I have saw, but if I compare both the books I found Nelson far better than that by the Piyush Gupta sir book. In fact, in all the exams where it is NEET SS or INI SS, the questions are directly repeated from the Nelson Textbook of Pediatrics images or the text which is given in it. So it is very necessary to read this book. At least you have to read the important topics. Now, the second book in the list will be the Cloherty Textbook for Neonates. This is the latest edition of the book. This book is the most basic, not most basic, but one of the important books for the neonatology. But if I have to compare this book with AIMS NICU protocol, AIMS NICU protocol is far better and is in easy language. I This book is also necessary because it has some basic information is given far better in this book in relation to AIMS NICU protocol, but still this book is a bit boring to read, but anyways we have to buy it because it is one of the most important books to read. Then these 2 books are we have to anyway buy. After that there are number of books which are related to the various subspecialties of pediatrics which you will have to buy in the due course of time. So I will quickly tell something about every book. The first book in pediatric subspecialty which I will talk is Park's Pediatric Cardiology. This is Park's Pediatric Cardiology. I have read this book, but I can say this with Perly, then this book is not required at all. Except only some portions of ECG are good in this book. Left other things can be covered with Nelson only. Then we have Book of Pediatric Nephrology by Dr. Arvind Bagga sir. This is the book. I don't think new edition has come or not. Actually there are 2 types. This is textbook and there is one protocol book by the same author. I have bought this book. It's good. It's easy to understand and it is given in much detailed information. Actually in the nephrology part we generally follow the principles which are we used in Indian context. So Nelson Textbook of Pediatrics, the treatment protocol there is not of much value for us. So this book we have to ultimately buy. If you read the OP chapter of nephrology, they have given the gist of the content given in this book. Then due course of time we will come across the ventilators, and for this there is the best book which I consider is the book by Suchitra Ranjit. This is the book Suchitra Ranjit book of Manual of Pediatric Emergency and Critical Care. This is I think for this subject, this is for critical care. This is one of the best book. They have given everything in very easy language. It is very easy to understand. Also, there is a separate book also, which is by Praveen Khilnani sir, Pediatric and Neonatal Mechanical Ventilation. But I found this book more advanced, and after achieving certain level, only you can take help of this book. Then coming to the other textbooks, there for examination purpose we have two textbooks. One is Scott Pediatrics. This book, actually, it has been written in the form of question answer form. I mean, let us suppose you have to take history of severe acute malnutrition. Then what questions are to be asked? What parameters have to be assessed? What theory which you can be asked in the exam? This book has mentioned in detail. There is another book by Mayur P. Chheda sir. So that book is also good. If you compare both the books, then both are of the same level. But that book is small one. This is a more thicker one. ठीक है? Frankly, for pediatric hemato-oncology, no such book is required except Nelson, and OP has also given the hemato-oncology in the great detail. But if you want to read book, then there is one book by Dr. Anupam Sachdeva and M.R. Lokeshwar. This book. Few topics like thalassemia, their management, and chelation therapy is given in good detail in this book. But I still think that this book is not that much required. Okay. Then there are two other small textbooks which you will might need in the due course of time. First is for mainly used for severe acute malnutrition, which is nutrition book, book on nutrition by Elizabeth, nutrition and child development. Actually, if you see properly, so severe acute malnutrition is given in good and great detail in OPG itself. But if you want to know something extra, the mechanism behind it, then this book is good. Then there is separate book which I don't think is much required, but sometimes few books become necessary. So that is book for child and development, that Illingworth book, Development of Infant and Child. Still, I will advise not to buy it. If you get PDF, then it's good, because there is nothing extra which is given in the book which is not given in the OPG book. Now, barring this, there are few other things. One is the IAP textbook for immunization. That book comes in every 5 years. This is the book. The last edition was 2019, so probably next edition will come in 2023, 2024. In this book, you will get everything related to immunization in great detail. But this you can delay buying, and if necessary, you can buy this book. No issues. Now, I think I have discussed almost all books, and few things more about. There is one IAP textbook of pediatrics. I have not read that book, but I personally think that if you are reading Nelson and OPG, then it's not necessary to buy that book. Then we have you will get few IAP papers, like paper of about nephrotic syndrome from ISPN latest guideline, that you will learn in the due course of the time. Now, coming to the two most important factors, two or three. The first is, sir, what to do if which MCQ book is best. So, for in the NEET, in the MD pediatrics or DNB pediatrics, if you are reading MCQ book, then it must be oriented towards the super specialty examination. Frankly speaking, there are two books which are used. One is the Meenakshi Bothra ma'am book, but it's more basic. I mean, the information given there is related to FMG, NEET PG level also. But the best book which I found was this book of Sushant Bhanja sir. This is the book, Self-Assessment and Review of Pediatrics by Sushant Bhanja sir. Actually, the problem with this book is that last edition came in 2018, I think, 2018, 2019. After that, no edition has come of this book. And believe me, this year I had NEET SS rank 27, and this book is one of the important reasons for my rank, because there are many points which are given in great detail in this book, which you will find to be repeated in many exams, especially competitive exams like INISS or NEET SS. Now coming to coaching, there is another book by Arun Babu book is also there, but I have not read this book, so I can't tell much about that. Then there is then about coaching. Actually, there are mainly four coachings for NEET SS of pediatrics, NEET or INI SS of pediatrics. They are Prep Ladder, uh, uh, the coaching by Sushant Bhanja sir, and then there is ADR Plexus coaching, and fourth is the speed coaching. So I have among them ADR Plexus. I have not taken any coaching. I just saw their YouTube video. There was the call session video. That is good. Second is the Atoms coaching, which is by Dr. Sushant Bhanja sir. I had not taken that coaching. Just his book, as I have mentioned, is good. It's for PG level, but it is given more advanced than PG. Now among speed and prep ladder, I took prep ladder. Speed I took about 2 years back in 2020, but at that time it was very in the initial stages. So I didn't read it completely. This year for giving NEET SS, I took prep ladder, and this is good. Matlab, this is my experience is good with this coaching. Except obviously there are few cons, like the few lectures are not there, but still among four I think it's the best. Obviously it's not any sponsored video. Actually, in prep letter they provide you with notes. They provide me last year with these two notes. Two volumes of notes are there, one and two. So if you want to take coaching, you can take prep ladder, and but they have given in great detail. So you have to use it judiciously, because it is very extensively given there. Rest it depends on you. Many people find speed also good, so it might be. I can't say much about speed. So summarizing it all, the five books which I mentioned in the previous video are important. Followed by, if you ask me about five more books which we have to read, then it is Nelson textbook of pediatrics, Cloherty. Then followed by nephrology book of Baghasar, and Suchitra Ranjit book of emergencies, and the last one will be the Scott pediatrics uh, for examinations purpose. So this was the video. In the subsequent videos, I will try to cover how to read Nelson and how to make effective use of it. So this was the video. Thank you.